Let's go to visual diagnosis inspection. The topic is partially swollen tongue body and sunken areas. Whilst an entirely swollen tongue will be due to a she condition of dampness, phlegm or accumulated fluids, a partially swollen tongue can be a sign of a deficiency or an excess condition. Qi deficiency, qi stagnation, and heat can all result in the swelling of certain areas of the tongue. The areas of the tongue that most often swell up are the tip, the central area, and the edges of the tongue. If the sides are swollen, it is important to differentiate between whether it is the whole side of the tongue that is swollen, which is a liver imbalance, or just the sides in the central area of the tongue, which is spleen qi deficiency. If the swollen sides are also red, this indicates liver heat. If they are normal in color, there will be liver qi stagnation. The reason that spleen qi deficiency can result in swelling of the sides of the tongue, which is an area normally associated with the liver and gallbladder area, is that when the spleen area in the middle of the tongue swells, this forces the side of the tongue outwards in this area. Spleen qi deficiency swelling will usually result in there being teeth marks on the side of the tongue. If there's phlegm dampness or qi deficiency in the lung, there will be swelling of either the whole of the front third of the tongue or just the sides of this area. The tip of the tongue can swell where there are heart imbalances. This will typically be seen if the mental emotional aspect of the heart, the shen, is not in balance. The tip will usually also be red in these situations. When the tongue is partially swollen, it indicates either the localized presence of phlegm in a specific part of the body, or if the tongue is red, there's heat. The tongue may be partially swollen in the following areas: the tip, the front third, sides between the center and the tip, the sides in the central section, and the whole side. Here we can see the picture of the first one being a swollen tip, and the second one is swollen on the front third, and the third one is the swollen chest or breast area. And here we see that the sides on the central section, that is the stomach and spleen, is also swollen. And here on the second one, it's the sides, which is the whole sides, and that is a liver that is swollen. Here you can see it in color as well. The swollen tip is the heart, and the swollen front third is the lung, and the swollen chest or breast area. And the sides here as well is the central section, the stomach and spleen. And here in the sides, you can see the whole side of it is swollen. A swelling in the tip indicates emotional stress affecting the shen. It usually appears in conjunction with the redness of the tip. As indicated earlier, changes in the area between the center and the tip reflect the pathology of the heart, lungs, or breast in a Western medical sense. A change in the chest area may involve a change in color or body shape. How to differentiate when a change in the chest area indicates a problem of the lungs or heart or of the breast in women? A change in the chest area indicates a pathology of the breast in women rather that of lungs or the heart. Number one, it's the absence of an obvious lung or heart pathology. And number two, especially when it is unilateral. Examples of lung pathology manifesting in the chest area are chronic asthma or chronic emphysema, in which case the chest area would be swollen and possibly purple. An example of heart pathology is chronic coronary heart disease, in which case the chest area would be purple. As the area on the sides between the center and the tip reflects the condition of heart, lungs, and breast, we shall call this the chest area. A swelling in the chest area indicates retention of phlegm in the lungs or in women in the breast. Especially when the swelling is unilateral, it is more likely to indicate phlegm in the breast. A swelling in the front third of the tongue indicates retention of phlegm in the lungs. This is often a residual pathogenic factor from previous invasions of wind. A swelling in the central section on the sides indicates retention of dampness with spleen deficiency. The swelling in the liver area indicates liver heat or liver fire. Some areas of the tongue can appear to have sunk downwards. This indicates a condition of qi deficiency in the organ that is reflected in this area of the tongue. The depression in the tongue surface can sometimes only be seen immediately after the person has presented their tongue, and then the area fills up and the depression is no longer visible. It is sometimes necessary to get the patient to extend their tongue a couple of times to be sure that you have observed the depression correctly. On the other hand, an area of the tongue may only collapse after the tongue has been extended for a while. In both cases, this will most typically be seen in the area corresponding to the lung or the spleen and stomach, and is indicative of qi deficiency in these organs. If the root of the tongue is sunken, this can be a sign of kidney jing deficiency. Thank you so much for your attention.